Can fertility be preserved before cancer treatment? Can fertility be preserved before cancer treatment? Yes, it can often be preserved through several established medical options. The choice of method depends on factors like the patient's age, type of cancer, urgency of treatment, and individual fertility goals. Fertility preservation is especially important when cancer therapies pose a significant risk of causing infertility, generally when the risk is over 30%. For patients facing treatments that can harm fertility, such as chemotherapy, radiation, or surgery, early consultation with fertility specialists is crucial. This helps patients discuss available options and make informed decisions without delaying necessary cancer therapy. For women, several common fertility preservation methods exist. One option is oocyte cryopreservation, which involves hormonal stimulation to mature eggs. These eggs are then retrieved and frozen for future use. This process typically takes about 2 weeks, which may delay cancer treatment. Another option is embryo cryopreservation, which is similar to egg freezing but involves fertilizing the eggs with sperm before freezing them. This method usually requires a partner or donor sperm. Ovarian tissue cryopreservation is another method where ovarian tissue is surgically removed and frozen. This can later be reimplanted, making it particularly useful for prepubertal girls or when immediate cancer treatment is necessary. While some authorities still consider this experimental, it has led to successful pregnancies in some cases. Oophoropexy is a surgical procedure that moves the ovaries out of the radiation field to minimize damage. Additionally, the use of gonadotropin-releasing hormone agonists can help suppress ovarian function during chemotherapy, potentially reducing damage, although their effectiveness can vary based on cancer type. For men, sperm cryopreservation is a common method where sperm is frozen and stored before treatment for later use. Radiation shielding can also protect the testes during radiation therapy to reduce exposure. In pediatric patients, options are more limited but can include ovarian tissue cryopreservation for girls and experimental testicular tissue, freezing for boys who have not yet reached puberty. It is important to note that current fertility preservation methods do not seem to compromise the success of cancer treatments or increase the risk of cancer recurrence. However, delaying cancer therapy to pursue preservation can be harmful. There is some concern about reimplanting frozen tissue, potentially reintroducing cancer cells, depending on the cancer type and stage. From the perspective of fertility and endometriosis, it is essential to recognize that endometriosis can affect fertility, and cancer treatment may complicate these challenges. Therefore, discussions about fertility preservation should be tailored to each individual, considering both cancer and any underlying reproductive conditions. Specialized counseling from fertility experts before cancer treatment has been associated with better psychological outcomes, less regret, and improved quality of life for survivors. This underscores the importance of early referral and patient education. In summary, fertility preservation before cancer treatment is feasible and recommended when appropriate, using established medical techniques that align with current scientific consensus and guidelines. Personalized care and timely counseling are essential to balance the urgency of cancer treatment with fertility goals.